Hello, everyone. This session is about a discussion on e-health. Um, Although I know that you have your informatics this semester, it's just the same. Let's discuss, at least the uh, summary or the overview of e-health, especially in e-health in community health nursing. Um, as you have discussed in informatics, that e-health is the digital. By the way, I'm using my mind mapping to facilitate this discussion in that PowerPoint slide, so that to also help you organize the concepts in your mind. Now, again, as I have mentioned, I'm sure that you have learned already from nursing informatics that e-health is the use of digital information and communication technologies, such as computers and mobile devices, to access healthcare services remotely, no, and also remotely manage healthcare. And these may be technologies that are used from home or that the doctors and nurses use to improve or support healthcare services. Now, in the Philippines, the current state of e-health, and its development um, has been studied. And uh, studies reveal that when it comes to the availability of healthcare services, Filipinos often experience a crisis brought about by factors such as high cost, poor accessibility, especially that there are areas also with less reliable internet connections, and almost in some areas it really has no um, internet accessibility, like the one in our like the community that we are partnering with in Wawa Rizal, because of the mountainous area. So internet signal, cell phone signal is not accessible in some areas. So yan, poor accessibility and lack of patient data or information is also one factor that, of course, that affects how Filipinos access healthcare services. On high cost, a recent study shows that 40% of Filipinos are unsure whether they can pay for their medical bills, while 35% do not know whether they can afford regular checkups. In a country like ours, where more than half of health spending comes from out of the pocket payments, this uncertainty greatly affects and deters citizens from getting necessary healthcare. Even though we already have the universal healthcare law, and even with the PhilHealth insurance system, still, many find themselves in such a predicament whenever someone in the family is hospitalized, because they're worried about, yeah, how can they pay the soaring medical bills, depending on the gravity also of the condition and the extent of the therapeutic modalities that will be used. Okay, so that's about high cost. On poor accessibility, even though I've mentioned it a while ago about the internet connection, but according to the Philippine Department of Health, only 13% of all healthcare providers and 40% of all tertiary hospitals are located in rural area. So since they are, uh, if you take a look at the figures, 13% of all healthcare providers and 40% of all tertiary hospitals are in the rural area, which of course limits the provision of healthcare services. And as a result, 70% of the population in these places have little to no access to healthcare services. However, even where healthcare is available, access is not so easily obtained. And on the average, according to studies, it takes a Filipino 39 minutes to travel to the nearest health facility. No? So, and this 39 minutes can sometimes mean life or death, no, in the worst circumstances. Okay, so yeah, that's the picture on poor accessibility. Aside from the internet reliability. And also another factor is the lack of patient data or information. Um, Even assuming healthcare is affordable and accessible, a problem still stems from the fact that patient data or information, which are necessary in order to provide adequate healthcare, is often incomplete, sometimes inaccurate, misplaced, especially for uh, yun, yung mga papers, mga printed uh, patient information, and at times simply unknown, no, these patient data. So different healthcare providers all too often fail to harmonize their, I know, also the different healthcare providers often fail to harmonize their different data formats, which also affects exchange in patient information and thereby compromising the quality also of information that are shared. Also, bureaucracy even more exacerbates the poor processing of these data, with some estimates pegging data validation at more than a year, no, to reach various levels. So imagine that bureaucracy just to get pertinent information. Sometimes it takes a long while before you can get hold of those important information. Okay, so that is the backdrop. Now, what is the proposed solution? So the Philippines now developed a framework for e-health to respond to these needs of the country. And it is envisioned that by 2020, e-health will enable widespread access to healthcare services, health information, and securely share and exchange clients' information in support to a safer quality healthcare that is more equitable and responsive health system for all the Filipino people. By through how do are we going to do this? By transforming the way information is used to plan, manage, deliver, and monitor delivery of health services. So so uh, specifically, there are information technology enabled health services that were framed. Also, another solution is information technology in all public health facilities. It's another strategy. The certification of electronic medical records and accreditation also, no, of organizations who are using electronic medical record uh, to ensure, of course, the privacy and confidentiality of this information, and also to ensure that organizations are observing the protocols. Also, more strategies were developed on health data standards, use, and also proper implementation of the Philippine Health Information Exchange system. So DOH has taken the lead, spearheading initiatives such as the Philippines e-health strategic framework and plan from 2014 to 2020. So I'm sure that in your nursing informatics subject, you have seen already the many ways, no? Informatics, information technology, and communication technologies are able to make the work of healthcare providers more effective and more efficient. So yeah, so imagine no, a diabetic patient again who is using a mobile phone or other devices to upload food logs, medications, dosing, and blood sugar levels that can also be reviewed by nurses and doctors who can also respond electronically. Just imagine the time and the effort and the money that will be saved, through these exchanges or through these activities, or maybe watching a video on carbohydrate counting and download an application to your phone if you are a diabetic. So again, saving time and effort, no, and manpower also, because health information can be disseminated through these applications. And so on, no? And yun. Now, the goal of telehealth, which is also called e-health or m-health or mobile health, includes making healthcare accessible to people, especially those who are living in rural or isolated communities. And uh, also another goal is to make services more readily available or convenient for people with limited mobility, limited time, or limited transportation options. Also, providing access to medical specialists, um, access to these informations online, thus improving communication and coordination of care among members of the healthcare team. Also, one of the goal of telehealth is to provide support for self-management of healthcare, because you remember, no, that one of our focus in community health is to empower the people, so that people will learn independence, will be taking charge of their own health. So e-health um, seeks also, to achieve that, as it aims to provide support for self-management and healthcare. In the Philippines, we have already adopted telehealth, as you have known also from nursing informatics, and we have become an increasing necessity, with the emergence of pandemic right now, and uh, along with the implementation of community quarantine measures. So these initiatives are facilitated, with the use of telehealth. So to promote safety among the public, telehealth has been adopted by private and government hospitals. In fact, the University of the Philippines, Manila, is one of the earliest in the Philippines who adopted the telehealth in 1998. And they did this by establishing the UP National Telehealth Center with the commitment not to engage people to use available technologies to improve healthcare, albeit distance, or barriers. Since its conception, the center continues to develop telehealth applications derived from people's own problem-solving contributions. And also through research cum service activities, the center helps both patients and healthcare providers maximize widely available and cost-effective information and communication technology tools to improve delivery of healthcare. Now, as you try to visit, the Department of Health website, you will find there the different e-health components along with the frameworks, for achieving the e-health vision for 2020. And these components includes governance, legislation, policy and compliance, standards and interoperability, e-health solutions, infrastructure, human resources, and strategy and investment, operational budget, procurement. So just to elaborate on a few things in governance, this usually involves directing and coordinating e-health activities at all levels, like hospitals and healthcare providers. So at all levels, from primary, secondary, and tertiary levels. And the critical areas usually involve management of the e-health agenda, the stakeholders' engagement, clinical safety, management and operation, as well as monitoring and evaluation, plus policy oversight. And of course, these e-health activities, this direction and coordinating e-health activities is based on the law. So there are legislation, uh, policy, and compliance component, in the website, which also ensures, that these activities of governance are within the bounds of the legislation and policies, and it ensures that all these activities are in compliance with the law. For standards and interoperability, This includes promoting and enabling exchange of health information across geographical and health sector boundaries through use of common standards on data structure, terminologies, and messaging. That's why time and again we have been discussing that as nurses, no, we have to be very clear with our nursing language, and we need to ensure that the other members of the healthcare team also understand, no, our terminologies, so that there will be unity, no, of information and of language. Um, One example of standardizing, no, is the implementation of software certification or accreditation, where e-health solutions must comply to be certified as capable of exchanging health information. So along with this would ensure privacy and confidentiality of patient health information. Okay. On infrastructure, it basically involves establishing and supporting health information exchange. So, of course, so there has to be sharing of health information again across geographical and health sector boundaries, and development of infrastructures like physical technology and software platforms, services, and applications to support again these information exchange. For human resources as a component, of course, we need people. No, we need manpower to be able to plan, no, on what kind of of technology can be used to facilitate effective and efficient delivery of healthcare. And that's why we are integrating nursing informatics also in the curriculum with the hope that in the future, no, nurses in the Philippines will be able to contribute more, no, in these e-health initiatives. Because after all, we are one of those in the front lines of care. We know better our patients because we spend more time with the patients. Okay, for e-health solutions, these are required services and applications to enable widespread access to healthcare services, health information, health reports, healthcare activities, and securely share and exchange patients' information in support to health system goals. Examples of these e-health solutions would be the electronic health records, no, the electronic medical or personal records, electronic referrals, medications management, distance learning, and electronic resources. Also includes telemedicine, mobile health, adverse event monitoring, even disease surveillance, just like what we're doing now during the COVID-19 pandemic. No, yun. I'm sure you have checked already the Corona Tracker, both in DOH as well as in WHO. Okay, so yun. So those are the components of eHealth. Now that you will be able to see now in the DOH website on eHealth. So what are the benefits? Of course, it improves communication. Benefits of eHealth system improves communication and responsiveness within the healthcare system. It also addresses obstacles to equitable access of healthcare and support other health initiatives such as universal healthcare law. So it becomes easier to do all this. Now, as part of the recent development, the House Committee on Health, chaired by Quezon Representative Angelina Tan, approved last January 22, 2019, a substitute bill seeking to establish the national e-health systems and services that will deliver health services through information and communications technology. The measure provides for an organized and structured application of electronic health or e-health integrated in the regular workflow of healthcare activities. Specifically, the bill seeks to utilize information and communication technologies to deliver health services, which has the potential to be profitable, improve quality, change the conditions of practice, and improve access to healthcare, especially those in rural and other medically underserved areas. The bill also aims to facilitate the exchange and access to secured personal health information, ensure harmonization or integration, alignment, and interoperability among various e-health initiatives and facility and facilitate interagency and intersectoral coordination at various levels of governance in both public and private sectors. So what is the implication of this bill? It only means that all e-health activities is supported now by the law, which also follows that corresponding budget can be allocated by the government on e-health strategies for the benefit of the people. Okay, so what is the role now of the community health nurse in e-health? As we all know, nursing includes the promotion of health, prevention of illness. Nursing includes the promotion of health and prevention of illness, as well as the care of the ill, disabled, and dying people. Also, advocacy as one of our primary role, especially in community health, uh, promotion of a safe environment, research participation in shaping health policy and in patient and health systems management, and of course, our education roles, our health teaching, which is very important to be disseminated in the community. And we can utilize different platforms right now and different ways, creative ways on how to reach the people uh, through our health education. Certainly, the this definition gives an indication of the diverse range of nursing roles. And it is such diversity that causes some difficulties in determining collectivity also amongst nurses. But uh, despite that, if you come to think about it, if Florence Nightingale is alive today, uh, we can be sure that she would be a champion for e-health from a nursing perspective. Because if you remember, it was she who invented the pie chart to demonstrate more clearly the issues of disease and public health in the Crimean War, no? And also how she tried to manipulate the environment so that to facilitate the healing, and health of the soldiers. So she observed, she used her observation, uh, also came up with solutions to the problems that she had observed, uh, that were being experienced by the patients at the time. So siguro she will really be happy right now with the advent of technologies on how it can facilitate nursing care more efficiently. Okay, so nurses on e-health, the choice is there, and the time to make the choice is now. Okay, the decision must be whether to act traditionally and have changed thrust upon the profession from the outside, or to anticipate this revolution in nursing practice. So familiarize nurses with it and prepare. Uh, let's prepare each other. As educators, we need to prepare you to take an active part in the introduction of technology, in the nursing community. So in general, nursing has covered its head and hope that this new development would go a long way. Okay. So nursing care is provided at an individual level with the aim to provide the best and safest care possible. And the nurse-patient encounter forms the basis of a person-centered care. So e-health is a tool that can be employed to support person-centered care, even though you are doing it at a distance, through telehealth. E-health needs to be integrated in our practice, irrespective of the roles, functions, and area of activity. Because e-health can support healthcare processes, as you have observed, when you were doing your electronic health record prototype in nursing informatics. Um, so we can ensure quality, patient safety, a person-centered approach, a more effective, a more efficient, and of course, continuity in the care process. Nurses also frequently have a coordinating function in the organization, which, among other things, includes the handling of health-related information. So this information should be available in the right format, in the right occasion, and to the right person in the care process as a basis for decision making. also for provision and evaluation of healthcare. And I'm sure that by this time you have realized already how information and communication technology would make all these tasks more efficient. So a prerequisite for e-health is to develop in that direction and to meet the patient's care needs is that nurses, irrespective of their role, will contribute with their knowledge and commitment. Okay? So yun. We need to be ready, to embrace it, also to offer our contribution in terms of knowledge and most importantly, our commitment to the role. Okay? So that would be all. Thank you everyone for listening. And I hope that you have again appreciated the importance of e-health in our practice. Thank you, everyone.